Pennsylvania health insurance premiums to rise by 19%. A staggering number of nearly 500,000 residents in Pennsylvania are facing the prospect of significant increases in their health insurance premiums next year. This alarming situation arises as insurers operating within the state's Affordable Care Act marketplace, known as Pennie, have proposed raising premiums by an average of 19% for individuals purchasing their own insurance and 13% for small businesses, as reported by the Pennsylvania Insurance Department on Friday. The Insurance Department plays a crucial role in reviewing these proposed rates to ensure they are fair, not excessively high or low, and do not discriminate against specific groups of customers. This year, the requests for rate hikes are notably higher than those seen in the previous year, where the average proposed increase was only 8% for both individual and small business markets. Pennsylvania Insurance Commissioner Michael Humphreys emphasized the importance of shopping around for health plans, stating, "This year, even more than previous years, Pennsylvanians should consider shopping around to find the best plans to meet their individual needs at a price that makes sense for their current financial situation." This advice is particularly pertinent given the substantial increases being proposed. In Western Pennsylvania, the two leading health insurers, UPMC and Highmark, are requesting premium hikes that, while below the average, are still significant. UPMC is looking to increase premiums for individuals by 12% to 16%, while Highmark's proposed increases range from 14% to 18%. For small business plans, UPMC is asking for a rise of 7% to 9%, whereas Highmark's requests are much steeper, ranging from 12% to 23%, marking the highest increases among all insurers in the state. Notably, the Highmark plan with the steepest increase is aimed at customers in the northeastern region of Pennsylvania. In the first quarter of this year, UPMC and Highmark reported profits of $237 million and $15 million, respectively. However, the financial health of these companies is just one of the many factors the Insurance Department considers when approving or adjusting rates. They also take into account historical rate changes, cost estimates, and the potential impact on consumers. Historically, regulators have tended to reduce requests for individual plans while making only minor adjustments to small business plans, which are typically purchased by companies with 50 or fewer employees. There are instances where regulators have approved rates higher than what was initially requested. The rising costs of healthcare, increased usage of medical services, and the impending expiration of enhanced premium tax credits that assist customers in affording insurance on the ACA marketplace are all contributing factors to these proposed hikes. According to Pennie, its enrollees save approximately $600 million each year due to the expiring program. To support their proposed increases, Highmark has pointed to the same issues highlighted by the Insurance Department, along with a surge in demand for medical care following the pandemic. David Golubevsky, a spokesperson for Highmark, stated, "We are committed to offering the high-quality coverage and experience that our Pennsylvania ACA members and small group employers have come to expect from Highmark." Similarly, Denise Hughes, a spokesperson for UPMC, for those interested in a detailed breakdown of the proposed rates by company and plan, a comprehensive list can be found on the Insurance Department's website. Public comments regarding these rate requests are being accepted until September the 2nd and can be submitted via email. Interestingly, the Insurance Department has not responded to requests for further comments on this matter. Jack Troy, a reporter for Trib Live, focuses on business and healthcare topics. A native of Pittsburgh, he joined the Trib in January 2024 after completing his studies at the University of Pittsburgh. He can be contacted at jtroy@triblive.com. Vermont health insurance rates. Modest increases still pose affordability challenges. When it comes to health insurance, many people are feeling the strain of rising costs. And while proposals for modest premium increases in 2026 may seem like a step in the right direction, deeper affordability issues still loom large. Insurers are suggesting relatively smaller rate hikes for the upcoming year as compared to those seen in previous years. However, healthcare regulators maintain that these proposed costs remain unmanageable for a significant number of individuals who are looking to purchase insurance. This concern follows a troubling trend of price increases over the past 3 years, during which average rates jumped by double digits. Last week, insurance providers presented their rate proposals to the Green Mountain Care Board, the state's regulatory body, discussing how their suggested increases would impact plans available on Vermont Health Connect, the state's health insurance marketplace. Approximately 35,000 individuals and families rely on this marketplace for their coverage, alongside many more who are insured through small businesses with fewer than 100 employees. It's important to acknowledge that the rates in the marketplace often mirror broader tendencies found in the commercial health insurance landscape, even though state regulators point out that these trends do not always provide a completely accurate picture. For instance, MVP Healthcare has proposed a rate increase of nearly 3% for both individuals and small businesses. Conversely, Blue Cross Blue Shield of Vermont has suggested much steeper hikes, around 15% for individual plans and a 7% increase for small businesses. According to actuaries chosen by the Green Mountain Care Board, these significant increases at Blue Cross are partly attributed to the insurer's precarious financial situation. Ruth Green, the chief financial officer for Blue Cross, expressed during the hearings that the company's financial health is quite fragile. "Our financial position is very compromised," she noted. "Our reserves are depleted and we must avoid any further losses." This comes on the heels of a staggering report that Blue Cross lost $62 million in 2024. Marking the 4th consecutive year where claims filed by patients surpass the income generated from premiums. The insurer's healthcare costs have consistently exceeded expectations, raising red flags for the financial viability of its offerings. Green emphasized the importance of analyzing the full fiscal results for 2025 to determine whether the premiums charged during that year were even sufficient. Interestingly, the rate increases could have been more drastic if not for recent legislation that limits how much hospitals in Vermont can charge for specialty medications. These new restrictions have reportedly reduced proposed rate hikes by about 4 percentage points, based on testimonies provided in public sessions. Vermont has been managing premium increases that considerably outpace those seen nationwide for years. Consequently, the plans available on the state marketplace this year are deemed the most expensive across the entire country. Public comments during this review process revealed a strong sentiment urging the Green Mountain Care Board to deny the proposed rate hikes, focusing on the continuous concern for affordability. It feels like Blue Cross Blue Shield and the UVM Health Network have lost sight of the realities many of us face, remarked Shasta Fowler from Montpelier. As a staff member at a social service organization, she expressed concern that escalating premium costs are already undermining her work, saying, "This is simply unworkable if we cannot afford to live here." Another significant issue raised pertains to the potential expiration of federal tax credits that are scheduled to end in December 2025. These credits, initiated in 2021, have provided relief by capping marketplace premiums at 8.5% of income for individuals earning over approximately $62,000 annually, or 4 times the federal poverty level. The loss of these credits would mean that many middle and upper income individuals might be forced to absorb the full cost of their insurance plans, leading to premium prices that could potentially double or even triple. Amy Lester from Plainfield highlighted this concern with a personal example, worrying about her son, a 28-year-old roofer who currently benefits from the subsidies on the marketplace. She fears that without them, he may prioritize paying for his truck over acquiring health insurance. I can assure you that his truck payment is going to come first, Lester mentioned, expressing her deep concern. And that terrifies me. If Congress does not intervene, these changes will take effect on January 1st, regardless of the decisions made by the Green Mountain Care Board. In testimony, representatives from Blue Cross projected that as many as 3,000 individuals might exit the marketplace due to the cessation of the subsidies. Both MVP Healthcare and Blue Cross observed that this potential loss of members, who generally represent healthier demographics, may lead to premium increases of over 6% more than what would typically be necessary. This assessment aligns with similar predictions from insurance companies across the country. As the Green Mountain Care Board prepares to announce its decision regarding the proposed insurance rates for next year by August 22nd, it raises an important question. How will changes in premium costs and policy modifications affect your financial health and access to care? Let's discuss. What are your thoughts on the implications of these unresolved affordability challenges? Do you agree or disagree with the proposed rate hikes? Your voice matters.